Psychiatrist explanations. What is the relationship between mental disorders and crime? It has been difficult for the psychiatrists to derive criteria that would help them decide which offenders are mentally ill. According to the psychiatrist Seymour L. Halleck, the problem lies evolving conceptualization of mental illness. Traditionally, the medical profession viewed mental illness as an absolute condition or status. You are either afflicted with psychosis or you are not. Should such a view concern us? Halleck suggests that it should, although his kind of thinking is not compatible with current psychiatric knowledge. He writes, it continues to exert considerable influence upon psychiatric practice. As applied to the criminal, it also leads to rigid dichotomies between the sick criminal and the normal criminal. Halleck and other psychiatrists such as Carl Menninger conceptualize mental functioning as a process. Mental illness may not be considered apart from mental health. The two exist on the same continuum. At various times in each of our lives, we move along the continuum from health toward illness. For this reason, a diagnosis of criminal or mentally ill, may overlook potentially important gradations in mental health and mental illness. Today, such mental illness is called psychopathy, sociopathy, or antisocial personality. A personality characterized by inability to learn from experience, lack of warmth, and absence of guilt. What is psychopathy? What is psychopathy? The psychiatrist Harvey Cleckley views psychopathy as a serious illness even though patients may not appear to be ill. According to Cleckley, psychopaths appear to enjoy excellent mental health, but what we see is only a mask of sanity. Initially, they seem free of any kind of mental disorder and appear to be reliable and honest. After some time, however, it becomes clear that they have no sense of responsibility whatsoever. They show a disregard for truth, are insincere, and feel no sense of shame, guilt, or humiliation. Psychopaths lie and cheat without hesitation and engage in verbal as well as physical abuse without any thought. Cleckley describes the following case. A 16-year-old boy was sent to jail for stealing a valuable watch. Though apparently untouched by his situation, after a few questions were asked, he began to seem more like a child who feels the unpleasantness of his position. He confessed that he had worried much about masturbation, saying he had been threatened and punished severely for it, and told that it would cause him to become insane. He admitted having broken into his mother's jewelry box and stolen a watch valued at $150, He calmly relayed that he exchanged the watch for 15 cents worth of ice cream and seemed extremely satisfied with what he had done. He readily admitted that his act was wrong, used the proper words to express his intention to cause no further trouble, and when asked, said that he would like very much to get out of jail. He stated that he loved his mother devotedly. I just kiss her 10 or 12 times when she comes to see me, he exclaimed with shallow zeal. These manifestations of affection were so artificial, and one would even say unconsciously artificial, that few laymen would be convinced that any feeling in the contrary sense lay in them. Nor was his mother convinced. A few weeks before, this boy was sent to jail. He displayed to his mother some rifle cartridges. When asked what he wanted with them, he explained that they would fit the rifle in a nearby closet. I have tried them, he announced, and in a lively tone added, why I could put them in the gun and shoot you. You would fall right over. He laughed, and his eyes shone with a small but real impulse. Psychologists also have found that psychopaths like Hans Asnick's extroverts have a low internal arousal level. Thus, psychopaths constantly seek external stimulation, are less susceptible to learning by direct experience. They do not modify their behavior after they are punished, are more impulsive, and experience far less anxiety than non psychopaths about any adverse consequences of their acts. Some psychiatrists consider psychopathy to be an artificial label for an antisocial personality. To Eisnick sums up this view by writing that the psychopath poses the riddle of delinquency. If we, if we could solve the riddle, then we would have a powerful weapon to fight the problem of delinquency. If we could solve the riddle, then we would have a powerful weapon to fight the problem of delinquency. Crime and mental illness. The view of psychoanalysts like Abrahamson and Halleck are supported by research that shows that many serious violent offenders suffer from some sort of mental disturbances. James Sorrell's well known study of juvenile murderers, Kids Who Kill, found that many homicidal youths could be described in such terms as overly hostile, explosive or volatile, and noxious and expressed and depressed. Likewise, in a study of 45 males accused of murder, Richard Rosner and his associates found that 75% could be classified as having some mental illness, including schizophrenia. While the general public may be concerned that the mentally ill are a menace to society, there is little evidence that mentally ill people are generally violent or criminal. Research indicates that people who have been diagnosed as mentally ill or have undergone treatment in mental institutions are no more criminal or violent than the general population and less violent than prison inmates. In fact, recent research conducted in New York shows that upon release, prisoners who had prior histories of mental disorders were less likely to be rearrested than those with no prior hospitalization experiences. Thank you for listening.